So we have two treatment options for cholangiocarcinomas. One is the medical treatment, and other is the surgical treatment. And the medical treatment obviously depends upon the location of the tumor. It's like intrahepatic location or extrahepatic location. So for the intrahepatic cholangiocarcinomas, you have to decide for resectability or not, and CT and endoscopic ultrasound is really going to help you with that. So in case resectability, you're not sure about the resectability, or you're not sure about the ablation, then what you can do if you have already resected the disease and there are microscopic margins are left, or there's a residual local disease, then either you go for re-resection or you go for ablation, or you have to put the patient on chemotherapy. Like most of the time you have to combine the re-resection and then putting the patient on a chemotherapy like 5-fluorouracil or gemcitabine regimen is also being used for that. And then if you have already put the patient on a chemotherapy, then it is recommended that you have to you have to go for imaging studies for 6 months, every 6 months for at least 2 years. So that is the recommended guideline. Now, if the tumor was resectable, or the surgery, local radical resection, was already being performed and there are negative margins, then you have to consider imaging every 6 months for 2 years. So you have to apply the same principle here if the margin came out to be negative. Now, if the tumor is unresectable, and then you have to put your patient on chemo and a radiotherapy. Now, it depends upon which regimen you're actually going to follow, putting the patient on 5-fluorouracil or giving a shot of gemcitabine. And then for metastatic disease, you can also use the chemotherapy. So remember, it's important the resectability should be decided. If the tumor is resectable and you have already done with it a local radical resection and the margins came out to be positive, then either you go for re-resection or you plan for chemotherapy. And if the tumor is unresectable, you plan for the chemotherapy, and you have to put your patient on regular follow-ups 6 months, every 6 months for at least 2 years. Now, for the extrahepatic cholangiocarcinomas, again, the same thing you have to follow. If resectable, then resect. And if there are microscopic margins, they came out to be positive, or there is residual local disease, then again consider putting your patient on brachytherapy or a chemotherapy. And if the margins are negative, then tell your patient to come up for regular follow-ups or observe, or you can treat patient with chemotherapy. And unresectable and metastatic tumor, you have to give a palliative therapy, or you have to give a proper chemotherapy, or you have to put the patient on brachytherapy or external beam. So remember, the resectability, to find out the resectability is important. If the tumor is resectable, then what you need to make sure is the negative margins. Okay, so margins should be negative at any cost. If they come out to be positive, then you have to go for a re-resection, or you have to give a chemotherapy to your patient. And if the tumor is unresectable, then you have to go for a palliative therapy, and you have to put the patient on a proper chemotherapy. If there are no mets and the tumor is unresectable, then you can put the patient on a regular chemotherapy.